Welcome to Adapt NCLEX. Do you want to learn how to answer questions on integumentary system? I'm going to use 20 questions to give you key facts, concepts. I suggest you take notes, 20 questions. And so pay attention, take a note, and this topic will become easy for you. First question, what do we have? Straightforward question, right? Which label should the nurse place on the specimen? They receive a specimen, what label should we put on it? The nurse receive a biopsy from the middle, key fact, of the epidermis, key fact. Okay, buzzwords from the provider. What label should they put, the nurse put on it? Before you can answer this, you have to know that the skin has different layers. The top layer of the skin is epidermis. The middle layer is the dermis. And then you have subcutaneous fat here. Then you can have the muscle and the bone at the lower portion of it. The epidermis usually is between 4 to 5 layers. So mostly 5 layers epidermis. So the epidermis has 5 layers. The best way to remember them is straightforward. And this is the way I remember when I was in school. Okay. And it's related to the skin. Come, let's get sunburn. Right? Straightforward. So the first word is C. Second one, L. Third, G, S, and burn. Come, let's get sunburn. Right? The first one, C, is cornea. So this is number 1. The L is the lucida. The G is the granulosum. The S is the spinosum. And the B is the basale. So these are the layers, 1, 2, 3, 4, 5. We have 5 numbers. Which one should be the middle? The middle is number 3. So the specimen came from stratum granulosa of the epidermis. Straightforward, right? 1, 2, 3, 4, 5. So 3 is the middle number. So this is where I'm trying to let you think as usual. So that's the answer choice number 5. So let's get to it. Number 2. This is also concept. Which complication the nurse should anticipate? Complication. When I underline something is a buzzword. After the infusion, after. A client presents to the emergency room with burn injuries during a house fire. Client sustained what? 50% of total body surface burn. The caring nurse infused over what? 8 liters of normal saline. Which complication the nurse should anticipate after the infusion? Break the question down. Patient has 50% burn. Receive what? 80%, 8 liters of normal saline. What do you expect? This is concept. Forget about this. Something should be ringing in your ears. So why are you giving a patient who has a burn injury what? Normal saline. What is the fluid we use for resuscitation? We don't use normal saline. We use what? Lactate ringer. If you give them too much normal saline, because we know they're going to receive a lot of fluid, that's why we have normal saline. The side effect of normal saline is metabolic acidosis. You don't want this patient who is burned to be in metabolic acidosis. Therefore, the answer choice is straightforward. If you know the concept, you just pick the answer and you move forward. Hyponatremia. They are all already hyponatremic. As they burn, the sodium get diluted. They lose a lot of sodium. So they're already hyponatremic when they come in. Hemodilution, they are usually hemoconcentrated because they lose all the sodium and the fluid out. So the blood get concentrated. So this is wrong. Metabolic acidosis, yes. They are already in renal failure. It's not because you're giving them fluid. Even if I give you fluid, your renal failure will get improved. So it's test-taking skills. You know, if I give you fluid, why should it be in renal failure? There's no way. So the answer choice is number 3. Metabolic acidosis. Fluid for burn is lactate ringer, no, not normal saline. That is the key fact I want to emphasize. Match the following lesions with the description. This one you have to find way to remember them and picture them in case you see a question like that. I don't know what they give you in your exams, but sometimes you can make things up. You have to know the description, especially if they give you a picture, you should match it. Scale, right? Look at it. You can try and see it. This does not look like scales. Scales are like freckles, like something that will fall off easily. This does not look like it will fall off. This does not look, there's a little bit here, it's dry. This may have some scales, but it has stuck on definition compared, I mean, it's like a plateau. This look like scales, you can peel it off easily. So this is a scale. A vesicle is something that is fluid filled. Which one is fluid filled? You can see this is a vesicle. A plaque has scales on top of it, but it looks like a plateau. That's how I remember plaque. Plaques are like plateau. You see, the top is completely flat. It has flat surface. It has no hip. It's just flat. So this is a plaque. The macule, the way to remember macule is one of the smallest, I mean, it's flat. You can't even feel it. It's not palpable. You see, it's like flat on the surface. So this is a macule. And the Pustule keyword is pus. Which of these look like there's pus in it? Yeah, this one. So this is Pustule. So you have to be able to identify these pictures, okay? Let's keep on going. Next question. Select or apply. A nurse is caring for a client with 50% total body surface burn. Which of the following the nurse should anticipate within the first 24 hours? Burn questions is straightforward if you know the concept. This is your cell. When you get burned, what? The skin get lost, the blood cells split open. You have more sodium outside the cell and more sodium outside the cell and more potassium inside the cell. When you have a burn, the cell burst open, potassium come outside the cell, and the level goes up. Sodium is already outside the cell. You lose a bunch of it from dehydration, and then it get diluted, so sodium goes down. So potassium usually is going to be high. Sodium, is low. So we know that is going to be low for sure. Glucose is going to go high because of stress hormones. Stress hormone, epinephrine, norepinephrine released. So this patient is stressed, so your glucose is very high. Because of the loss of fluid, your blood is going to be concentrated. So your hematocrit is going to be high. This is also going to be high. This is also here. You're going to have metabolic acidosis with all this dehydration and everything. It's not going to be alkalosis. You're going to be acidosis. So this is wrong. Your RBC is related to your hematocrit. You lose fluid, so it's going to be what? Concentrated. So this is not happening. So your potassium, like I said, is high. Sodium is low. Glucose is high. Hematocrit is high. You get metabolic acidosis, and RBC is concentrated. It's called hemoconcentration. So this is related to that. So 2, 3, and 4 are your right answer. So in this situation, that's the answer. Number 5, what do we have? 4 clients present to the emergency room who need immediate intervention. Description, you have to be able to recognize what I'm talking about. We have multiple, white, scaly, it's like a scale. It's itchy, and he has plaque. I told you about plaques and plateau at the elbow. You know that this is psoriasis. Multiple, itchy, pruritic, erythematous, dry skin. Skin is dry. These are keywords, buzzwords. Itchy and dry at the elbow. This is atopic dermatitis. You have multiple, red, pustule, there's pus, buzzword, unencrusted. In your test, when you see unencrusted, that's the buzzword. You should not mix this. Lesion on the face. This is impetigo. Multiple stack on like this is also a buzzword. Stack on like lesion on the face. This is what we call seborrheic keratosis. And this is common in older patients. So among all these things, who do you think need immediate intervention? Standard precaution, standard precaution, standard precaution. This is contact. This is the way they can ask you this kind of question. So this is a contact precaution. So number 3 need intervention because we need to isolate that patient. Number 6, like I said, key concept, you should take note, buzzwords all over. A nurse is caring for a client with sacral wound described as what? What is the description? It's large wound, so it's a big wound. With deep, so almost all the layers are involved. Tissue loss, we've lost a lot of tissue, okay? So it's going all the way down. And we see what? Slough and eschar, black stuff in the middle of the wound. That is concealing the wound bed. So you can see the bed of the wound. You see what this is when you're taking tests, you're breaking down that you don't have to guess. Which of the following should be appropriate? Test taking skills. If I have a deep tissue wound, why would it be stage 1? Stage 1 is like sunburn. This is also a partial wound. It's not deep, okay? So it's not deep. 3 and 4, yeah, they're deep, but they don't have what? Slough and eschar concealing the bed wound. That means we have not been able to stage the wound. This is being staged. We know it's 3 and 4. 3, you know, you get to the fat. 4, you get to the bone and muscle. Unstageable wound is the wound that you have not been able to stage it. That is the key word, is concealing. That's the buzzword. I keep on saying buzzword. If you pay attention, you see that questions are like straightforward. You can pinpoint what is going on, break the question into 2. You know, concealing means on stage. We won't be able to stage because we can figure out what is going on. So this is unstageable wound. Number 7, a nurse is caring for a client who presents to the emergency room with burn injuries during a house fire. The nurse knows to classify, buzzword, classify the burn injury as major. This is a major burn based on which of the following. You have to know this. There's certain criteria we can use to say, oh, this is a major burn. Not every burn is a major burn, right? Like superficial burn is not a major burn. Electrical burn, yes. If you get electrocuted when you have burn, yeah, that's a major because there's cardiac involvement. Any burn injury involving more than 10% of your body surface, yes. If it involves your genitalia, yes. Anything in your face because of disfigurement is a major burn. It requires a lot of reconstruction. Your hand, you can't do your ADL, contraction. It's a major burn. Your feet is going to affect you. 2nd degree is a partial burn. It's not recorded. 3rd degree, yes. 4th degree, yes. But 2nd is not. So 1 to 6 are your answers. This is just to teach you things that you should know about major burn. You see something like that. If I give you all the answers, that means I want you to learn it. A client sustained over what? 60% of total body injury. Burn. Which of the following hormonal buzzword changes the nurse should anticipate to guide resuscitation stage management? A bunch of words. Don't worry about it. All I'm saying is patient at 60% burn. Which, after you have 60% burn in your body, what do you think? It does not matter the number. So for us, it's a major burn. There is going to be some hormonal changes to compensate during resuscitation. That's the first 24 to 48 hours. What is going to happen? Your body is stressed. So all stress hormone is increased. Cortisol level is almost 2 to 3 times normal. ADH, think about it. You've lost a lot of fluid. They are dehydrated. the first 24 to 48 hours when they come in, you have to release your ADH to increase absorption of fluid. Therefore, this is wrong. It should increase. I told you stress hormone, norepinephrine is one of them. This should increase. Dopamine is another one of the stress hormones from adrenal gland that will increase these catecholamine. Basically, everything is ramp up. Renin. Do you remember renin-angiotensin system during your school? Yes, it does. Okay, renin-angiotensin system will ramp up. This is secret from the kidney. It will lead to the secretion of what? Aldosterone. Eventually, you're going to make aldosterone from that. And if you make aldosterone, you go through angiotensin 1, angiotensin 2, then to aldosterone, right? If you make aldosterone is going to absorb all sodium and water so that your blood level goes up because of hypotension. Therefore, this is also increased. So 1, 4, and 5. This is a hard question. It's a thinking question. Concept, what you expect. Are your right answer? Number 9, what do we have? Which of the following teaching is indicated at discharge to the mother? A nurse is caring for a 5-year-old client with what? Buzzword. Unencrusted lesion. Unencrusted lesion that coalesces from multiple red pustules. So you have red pustules here, then they all form unencrusted lesion. What do you think? Buzzword, this is what? Impetigo. And so there is very, very contagious problem that you have to teach the mother so that they can prevent spread of infection. They can clean this wound with a mild soap before they apply antibiotic and water with it. So this is good. It itches the kid who's going to scratch it. So if they scratch it, it go under their fingernails and then it causes problem. It causes multiple recurrence. Therefore, trim the nail. Isolate them 24 hours after initiating of antibiotic. Usually they get like penicillin derivative antibiotic. They need to be away for 48 hours. They are not contagious after 48 hours of initiating antibiotic. Keywords, 48 hours of initiating antibiotic, they are no more contagious. 24 hours is not enough. Complete antibiotic therapy as prescribed. Yeah, continue to take your antibiotic. Wash clothes with regular temperature. No, you need high temperature to destroy all the organism that is involved. Can resume school after initiation of antibiotic. This is the same test-taking skills. If I have to wait for 48 hours, then I cannot resume school after I start antibiotic. So which of the following teaching is indicated at teaching? Clean the wound with soap and water, trim your nail, and complete antibiotic therapy. 1, 2, 4. Next question. Calculation. Of course, you can't go without doing this. A client presented to the emergency room with burn injuries during the house fire. Injuries include partial, pay attention, thickness, and full thickness, right? To where? Anterior and posterior of the right upper extremities and the left lower extremities, and superficial burn to the entire torso. So let's draw our caricature and see. I guess this is his hand, right? And I said partial thickness and full thickness to anterior. This is his left, and this is his right. Anterior and posterior of the right. So the front is 4.5, the back is 4.5. Of the right upper and left lower, this is 9, and this is 9. And superficial bend to the entire torso. So entire torso, front and back is superficial bend. Don't worry about it, that's 0. Superficial bend is not counted. Therefore, we have what? 9 plus 9 plus 9. That is what? 27. So 27 is the total body surface area burned. From the rule of 9, Parkland formula is what? 4 ml times total body surface area, which is 27, times their weight. Their weight has to be in kilos. So 154 divided by 2.2, this is 70. So 70 kilos. So when you multiply all this, you get 7,560. This is the total fluid required in 24 hours. So pay attention to the question. I just asked you total fluid required for 24 hours. If they ask you for 18 or the first 8 hours, and then the next 16 hours here, you divide the fluid and you do another calculation. You can check out videos on this, but this is a just for first 24 hours. So this is what you left with. Next question. Number 11. A nurse is caring for a client with what? Sacral wound, described as what? It's a large wound, deep tissue loss, slough and eschar concealing the wound. The same question, sloughing off, and you have all this thing deep. You don't see the base of the wound. Which action by the nurse is a priority? You see, I give you the same question by changing. I'm trying to trick you. Like, did you get it? If you're taking the test, oh, did I get it wrong or not? I'm asking you different questions. So don't focus on that. Focus on the question you are. Which action would you take? We all know, based on this, there's slough and eschar are buzzwords. It's telling you this is unstageable. Unstageable wound cannot be left alone. Nutrition, we need nutrition, but it's not important right now. Frequent position, yeah, they already have a bad wound. We will do that, but it's not important. You need to stage the wound. Far incident report is irrelevant. Remove the eschar and the slough to stage the wound. Then you can know how bad is the wound. Most of the time, when it's unstageable, they are either 3 or 4. When you remove all the eschar and the slough, you can figure out whether it's stage 3 or stage 4. So that's why you have to do that. So 3 is your right answer. Number 12. Select or apply. Which of the following teaching need further intervention at discharge? A nurse is caring for a client with new diagnosis of what? Atopic dermatitis. Keyword, this is not infectious. It just, your body is reacting to allergies, is so permeable that it's causing overreaction to some allergens. You can figure out. I will use mild soap and tepid water. The key is hydration and prevent scratching. That's all. And prevent the allergies. 3, hydration, prevent scratching, and that. So mild soap and tepid water is good to prevent activation of the scratching system. I will now enjoy my long bubble bath for skin hydration. This is a trap. If you take long bubble bath, your skin get dry. No hydration. So you get into trouble. So the question says, which of the following need further intervention at discharge? So this, you need intervention. This is good. So we need intervention here. I will apply emollient after drying myself completely. This is also a trap. The reason why we do this is to, and the emollient is to keep the skin hydrated. For these people who have atopic dermatitis, you pat dry your skin. You don't just wipe it really, really dry. You keep some water on and apply the lotion. So you should not clean everything out. If you clean everything out, we have a problem. Okay, so I will apply emollient after drying myself completely. You don't need to do that. I will trim my nails to prevent injury to the skin. Yeah, so that I don't scratch myself. I will avoid perfumes, which are irritant. Yes. So 2 and 3 need further intervention at discharge. Number 13. What do we have? The description is consistent with what? A nurse documented the lesion as what? Pay attention. Taken by as word epidermis. with rough and hardened from chronic inflammation in a client with what? Atopic dermatitis. We already talked about it. We know this is the problem. They itch all the time and then they scratch their skin. Multiple scratching in the skin. You see the epidermis become like lines, thickening epidermis, and you can see it, inflammation. This is from excessive scratching. What is the name do you describe it? Thickening epidermis with rough adding from chronic inflammation. We already saw scales, test thickening scales. Scales peel off. This is not peeling off. This is thickening. Telangiectasia, even if you don't know, these are something to do with blood vessel. This is dilated blood vessel on the skin that you can see. Keloid is hypertrophic scar, basically overgrowing of collagens, basically, and this is not it. Lichenification is the description of that. Scratching, and that causes the skin thickening from chronic inflammation. It's lichenification. Number 14. And this is caring for a client with what? Psoriasis. I try to give you the definition and try to see if you can get something good out of this question. Prescribe what? Pharmacology. Adalimumab. You can go with that pharmacology anywhere you go due to recurrent flare. Which of the following is indicated at discharge? A bunch of words. All the question is asking is, you have psoriasis, we give you this. You know, this is psoriasis, always need like immunomodulators. We call them DMARDs, immunomodulators. This is the TNF alpha medication that can make you immunocompromised. So most people with psoriasis, they take this medication, make them immunocompromised. What is the major problem with immunocompromised? Infection. So neutropenic infection. Avoid crowds. Avoid fresh vegetables. You're going to get sick. Avoid sick contact. Avoid IM flu vaccine. IM flu vaccine is not live. It's not a live vaccine. The nasal form is a live vaccine. So this is good. So you should not avoid it. So which teaching is indicated? No, this is not indicated. Avoid PPD testing? No. Before we give them this, Adalimumab, which will make them immunocompromised, we will place PPD to make sure they don't have activation of PPD while they're on the medication. So they get full-blown tuberculosis. We place it to make sure they don't have it. If they have it, we change it to if they've been infected before with latent TB. So you get a PPD positive before. If you get positive, you're not getting the medication. So you should not avoid it. This was a trap to test your knowledge about critical thinking. We need to place PPD to make sure they've not been seroconverted before. Number 15. Same question, same idea. Which of the following is required before the prescription? A client with severe acne vulgaris was prescribed what? Isotretinoin. This is what? Accutane. This is which we use for acne. It's very teratogenic. Because of that, we don't want you to get pregnant, because if you get pregnant, you're going to have a defective baby. Because of that, the month before, we got to make sure you're wearing condom and you're taking pills too. And then you have 2 negative pregnancy tests before we give you the medication. And during that time, while you're on the medication, we keep on doing that. You got to have it before even the refill. So which one is more comprehensive? That's all. 2 negative beta HCG tests 1 month before. Okay, this is good. 2 forms of contraception 1 month before the medication. Okay. This said 2 forms of contraception, it cover B, and 2 negative beta HCG 1 month before, it cover A. So this sounds like comprehensive. This said 2 forms of contraception drawing. No, the question said before. So this number 3 is much better. Number 5, this is comprehensive, but just to describe to you what you should expect when they ask you about changes of lesion, which lesion is worrisome for cancer. If 5 clients present to the dermatology, which client with skin lesion, client with skin lesion, which client situation is what? Concerning. The idea is A, B, C, D, E of lesion. A is asymmetrical, so it's not of the same size. B is irregular border, so the border is different. C is color, is changing. D is the diameter, is greater than 0.6 millimeters. Okay, no, 0.6 centimeters, right? It's greater than 0.6 centimeters, so it's 6 millimeters, right? And then E is evolving. The thing is changing. So 0.5 centimeter lesion, okay, that is round, it's uniform, no skin changes for 6 months. No, don't worry about it. It's 0.5, small lesion, but it's irregular, right? You don't have to have all these 5. Even one of them is important. Irregular border, okay, and the variation of color change for 6 months. I'm worried about it. 0.5 lesion, it bleeds easily and is growing. For the past, it's still growing. Bleeding is not good. 5 centimeter lesion, right? And it's what? It's regular, it's uniform color, and no change. Don't worry about it. It's asymmetrical, 0.5, is growing, is bleeding easily, and color changes. 5 is worse. So 2, 3, and 5 are your right answer. Those are very concerning. Number 17. And next is teaching new graduate about the function of the skin. Which of the following the next should include in the teaching? Select or apply. This is just to tell you what are the good function of the skin. It prevents infection. That's why we have it. That's why people burn. You have to worry about infection. You have to worry about water loss. That's why burn people need a lot of fluid because they're going to lose it. Of course, it makes vitamin D from cholesterol. That's why you go into the sun to make vitamin D. It protects us from UV radiation because of melanin, pigmentation. It's one of the largest organs. The skin is an organ, even though it does not talk. It's an organ. It covers large portion of the body and protect the internal organ. So these are all functions of the skin. Number 18. And next is teaching you graduate about the layers of the skin, right? Which part contain, pay attention. It has hair follicle, but glands. It has connective tissue and blood vessels. The next should include in the teaching. The epidermis have hair follicles and other things, but it does not have glands, so it can be. Muscle is not part of the skin. Subcutaneous does not have, it may have all these things, but it mostly, it's just fat. So by process elimination, you know it's the dermis. When you cut yourself and you bleed, you have reached the dermis. That's why you're bleeding, and that's where blood vessels and connective tissue are located. Number 19. And this is providing teaching to new graduates about skin changes in the elderly. You know, elderly patient, that's why you have to take care of them. That's why they develop sickle, D-cube, and all those things. There's a reason why the skin undergo changes as you grow, unfortunately. And the biggest problem is blood flow. There's decreased blood flow, so it's become atrophic. It breaks easily, so there's no increased blood flow. It loses elasticity. That's why they have wrinkles. Okay, so there's no increase. They form hemangiomas in their skin, but small blood vessels, so this is good. They have less fat. That's why they can get cold easily. The skin becomes very thin. It's not thick. And the skin does not undergo changes that fast. Mitotic rate decreases. So the only answers is 2 and 3 and 4. These are concepts you have to know, and you can manage the patient based on that. And the last one, this is to let you know that you have to know these things. Don't memorize it. Put them together. Like I said, this is the first series. I'll put them so that you know all the definition of them. Look at the way it sound, and then come up with your strategy to remember them. So the macule does not look like something that is elevated, right? Like we saw, they're very flat, non-palpable. They're very small. It's macule. It's like it has no elevation sound, something macule, So, but it's colored lesion, like we saw in that question picture. So this is right. If it's greater than 1 centimeter, a macule which is flat, non-palpable lesion, less than a centimeter. But if it's greater than a centimeter, it becomes a patch. And every patch is flat. So patch is basically macule greater than 1 centimeter. That's all. So this is good. Then you come to this nodule and tumor. I just try to put them together. You see nodule, it sounds like some Stockholm, something you can feel it. It's a nodule on my skin, right? It's elevated and it's solid, it's hard. It can be soft though. And it's round and it's palpable. It's less than 2 centimeters. If it's greater than 2 centimeters, that's what tumor is. The same thing, elevated, hard, round, palpable. That's all, the same thing. And vesicles, yeah, of course, it's elevated, but what is the key between vesicle and nodule? This is fluid filled. It's not solid or soft. It's like you can see the fluid in it. So fluid filled blisters and less than 0.5 is a vesicle. Become a bulla if it's greater than 0.5 centimeters. That's all. So find ways you can pair them. Like I said, this is the first series. I'll put them all together and you'll be able to remember all these names you got to figure out. This is the first portion, 20 questions. Take care of yourself. If you don't subscribe, look down. But this is Integumentary System to show you how they can ask you questions. These are key concepts you should know. Take care of yourself and subscribe for more content like that. All the best of luck. Bye-bye.